Hi, my name is Trey Custer, and the workshop I will be presenting is SCARred, Working with Amputee Veterans with PTSD. PTSD and amputation affect everyone regardless of the situation. It is most commonly associated with veterans. Knowing the psychological and physical factors that affect a veteran can help families to help their family members who are in the military. This can also help a therapist to help their client to get the most out of their rehab and what to avoid during rehab. So knowing these factors can help therapists design a program tailored to their clients and help families to know and understand the physical and psychological factors facing their family members in the military. For the objectives, we will be covering physical and psychological factors facing PTSD veterans, physical and psychological factors facing amputee veterans, exercises, and ways to help against these physical and psychological factors. For our first bullet point, we will be talking about the psychological factors of PTSD. These include panic attacks, irritability, hard time concentrating, constant fear, guilt, or shame, negative self-esteem, difficulty concentrating, anger, hypervigilance, increase in the chances of substance use, anxiety, and depression. As you can tell, some of these psychological factors are factors that people today face as well, such as anxiety and depression. You might be wondering what hypervigilance is. Hypervigilance is when the body is in a state of constant action and the nervous system is overloaded to where the person thinks that there is something there or something or someone is there when it's not. This can be a problem for a therapist because if they are more focused on what's around them or who's around them, they will be less likely to focus on the exercise and in turn do the exercise. We also have increases in the chances of substance use, which people with PTSD have a tendency to go towards since it might help them with numbing the pain or forgetting the event that caused the PTSD. And according to my sources, this is just not the case. It actually makes it worse. Okay, so for the next one, we'll be talking about the physical factors of PTSD. These include uncontrollable shaking, heart palpitations, lack of motivation, seclusion, difficulty sleeping, reckless behavior, aches and pains with no cause, and substance use. As you can see, we have substance use here again because, like I said before, people who have PTSD tend to go towards substance use for the reason being that they believe it will help them to either numb the pain of the event that caused the PTSD or to forget the cause of the PTSD. And as I said, according to my article, this is just not the case. It actually makes it worse. We can also see on this list lack of motivation, seclusion, and this actually is can be linked with depression, since with depression you don't want to get out and meet people, your social life is really affected, you really lose motivation to where it's even probably hard to get out of bed. Next, we'll be moving on to amputation, specifically the psychological factors of amputation. These include depression, phantom limb, PTSD, anxiety, distress, self-esteem and body image, impacts to their social life, and they experience the 5 stages of grief. So for this slide, according to Serious Law, one of my sources, the fact that a normal body image involves all 4 limbs, having lost one, will seriously affect a person's body image. Also, people that have amputations and their body and their body image is affected tend to hide their amputations out of fear. And according to serious law, this tends to happen more in people that are adolescent or above. Also, according to serious law, the same article that I have said before, depression can set into the early stages of injury and as time goes on. It also states in this article that people that have had amputations compare the loss of a loved one to the loss of a limb. Also, if a person is to have the proper help, they can get through the 5 stages of grief, which are denial, isolation, anger, bargaining, depression, and finally acceptance. And since soldiers, which are the main topic of this discussion, don't have a planned surgical amputation, they tend to have a greater psychological response to an amputation for that reason. Also, I have found that, according to my article in Industrial Psychiatry Journal, Psychological Effects of Amputation, a review of studies from India showed that psychiatric disorders among amputees was 10.4% to 63% depression rate, 14% to 92% of phantom limb syndrome, and a 3.3 to 56.3 PTSD rate. Okay, so now we'll move on to the physical factors of amputation. As you can see, there's a lot here. I have also included with prosthetic and without prosthetic, for the fact being that some people choose not to have a prosthetic and actually live without it. So for the physical factors, we have mobility and dexterity, phantom limb pain, infection, muscle contractures, deep vein thrombosis, fatigue, deep tissue injury, and ischemic heart disease. Also, with prosthetic, you have reduced phantom pain, a complication of postural alignment, complication of muscle imbalance and strains, and a complication with gait abnormalities. Now, without prosthetics, the factors you face are reduced activity, which this can lead to weight gain, increase in heart disease, among other things. Also, you overuse the one muscle because the one muscle has to overcompensate for that leg that's lost. It also puts a strain on it for the same reason. You can experience shoulder and back pains because you no longer have that one leg to support the other one, and instead it's focused all on that one leg. If it's an upper limb amputation, you can get tendonitis or bursitis as well as arthritis. You guys also might be wondering what bursitis is, since it's probably not a term that you have learned in class. Bursitis is a painful condition that affects the bursa, which are small fluid-filled sacs that cushion the bones, tendons, and muscles near the joint. And the reason that is important is because if they were to have this, that leaves the bones and the muscles and the tendons there's no cushion between each one, so they're going to be rubbing up against each other, which can cause further complications later on. I also found, according to an article called "What are some of the long-term physical effects of using and not using a prosthesis or not using a prosthesis," found that back pain was 50 to 80% more in lower amputees. I also found in this article that the ischemic heart disease was 2.4 to 4 times greater in a long-time amputee compared to a general populace. And finally, another statistic that I found in that same article was that roughly 60% of upper limb amputees with a prosthetic had a problem of tendonitis, bursitis, and arthritis. For phantom limb pain, you might be wondering how many people that affects. I actually found an article called Serious Law, which says that up to 80% of all amputees are actually affected by this phantom limb pain. I also found that muscle contractures, which you might not know, and according to Serious Law, are actually an imbalance of the muscle in the limb, and that the best way to avoid this is to have stretching exercises, which we will discuss later in the next couple slides. Also, if muscle contractures aren't addressed, this could also lead to pulmonary embolisms. Finally, for our last point that I will make in our objectives is the exercise and ways to help against these factors. For the exercises, I have included running, swimming, basketball, dancing, rock climbing, boxing, weight training, martial arts, and mindful breathing. For mindful breathing, to help against these factors, you will want to focus on each breath taken out, and you will want to take roughly 60 breaths. Also, these exercises from running to martial arts are great for your client because they help to focus on the body movements, which will get their minds off the psychological factors that might be facing them at the moment. For the ways and ideas to overcome these factors, I have a couple here. I have go to support groups, work with their dog or military dog if they have one. A healthy diet, avoid alcohol and drugs, cognitive behavioral therapy, also known as CBT, and eye movement desensitization and reprogressing, which is also known as EDMR. So for what I found about support groups, by going to support groups, specifically PTSD support groups, this can help the patient to feel less isolated and help them to overcome the symptoms they were going through and how to cope with them. This allows the person to not feel like they're alone, as well as it provides us good social support because these people that are at these support groups have been or are going through the same stuff as your client is probably going through. For the healthy diet, it is good that you have your client on a healthy diet for the fact that it helps reduce energy fluctuations and actually reduces mood swings, which can affect the other factors of PTSD and amputation. For CBT, or cognitive behavioral therapy, this allows the client to slowly expose themselves to thoughts and feelings that they experienced during the event. This also involves them to process the event and to get rid of the sporadic and skewed thoughts and replace them with a more balanced picture. For the next bullet point, eye movement desensitization and reprogressing. This includes a little bit of CBT, and it actually helps with PTSD and amputation and helps the person to overcome these factors. I mentioned dogs or military dogs. Dogs actually, according to Companions for Heroes, they actually help reduce medical costs, suicidal thoughts, mental breakdowns, substance abuse, and depression, which is a good, healthy alternative to going towards drugs and reducing these factors that these people face. The dog's duties also help a lot with these problems, from reducing panic and anxiety to reducing that hypervigilance, like I mentioned in one of the previous slides. In conclusion, at the end of this presentation, you will have learned the factors affecting veterans with PTSD and amputation, as well as ways, exercises to overcome these factors. You might think that this only applies to veterans, but you can use this information learned in this workshop for other patients of yours, because PTSD and amputation don't solely affect veterans, but everyone. So by knowing this information, you can better help improve your patient's life, whether they be a veteran or not.